meninges? Meninges means the covering of the CNS. Okay, whether it is brain or the spinal cord. So meninges now will include arachnoid matter, pia matter as well as the dura matter. Okay, so whenever a tumor grows in between the meninges, the tumor is called as meningioma. Okay, so a tumor which is present within the meninges of the brain and the spinal cord is known as meningioma. So tumor which grows out of meninges of brain and spinal cord is known as meningioma. Okay, are we clear till here? So meninges means the covering of the central nervous system, and whenever a tumor which is present, what is a tumor? Tumor is a what is a tumor? Tumor is localized collection of the. A tumor is an abnormal growth of the new tissue, which may be cancerous or may not be cancerous, or we can say it is a lump or a mass of a new tissue. Okay, which may be cancerous or non-cancerous. Okay, malignant or benign. So meningioma is a tumor which is present within the meninges of the brain. Usually what happens, it is slow growing. If we talk about the characteristic features of the meningioma, it grows slowly, although it is not the tumor of the central nervous system. But what happens is, although it does not include in our brain, very rarely it will go inside the brain. Very rarely it will go inside the protruding through the layers and going inside the brain. It will do it very rarely. But why is it included into the central nervous system? Because what it does is it puts upon the compressions on the adjacent organs or structures. Okay, on the adjacent structures, what will it do? It will compress and squeezing also. Squeezes and compresses the adjacent structures, okay, which are present. So now the question is, in which layer of the meninges is meningioma usually found? So usually it is found in a arachnoid matter. Okay, it is most commonly present in the arachnoid matter, and if we talk about the gender, usually common in women than in men, and most common tumor of central nervous system. Okay, so if we talk about the characteristic features, it compresses and squeezes the adjacent structures which are adjacent to the tumor, depending upon the site of the tumor. Then we have, it is usually found in the arachnoid matter, then it is usually found more common in the woman than in the man, and also it is one of the most common tumors present within the CNS. Okay, so next now we will talk about the other signs and symptoms which are present in case of which are seen in the patients with the meningiomas. Okay, so there will be So if we talk about the signs and symptoms also do not develop abruptly. Okay, so this meningioma is very less harming tumor. It does not provide so much harm to the patient. So the signs and symptoms usually develop slowly. Although when it grows in size, it varies in size, that we will discuss in morphology. Usually it varies in size from 1 to 10 centimeters. Say when it is growing, when it is about 1 centimeter, the symptoms may not be as prominent as that of an 10 centimeter. And also we know that tumor will not grow all of a sudden. It will not grow from 1 centimeter to 10 centimeter. It will take some time. So the development of the symptoms will also take some time. So the symptoms which are seen is, there is change in vision. You will see either blurred vision blurred vision or diplopia. Double vision will be present. Okay, and also problems in hearing. Ringing in the ears. Okay, his ears will be ringing. Okay, there will be a ringing sound in his ears. Okay, other than that, there is loss of memory, loss of smell. There is also weakness in arms and legs. Okay, so these are some of the symptoms present in the there is also seizures. Okay, seizures, the development of the seizures has also been seen in some clients. Say when the tumor has grown, now obviously it will be compressing the central nervous system. Because of that it might be causing faulty neurotransmission, and then it may result in the seizures as well. So the signs and symptoms which are seen in case of the meningiomas is change in the vision, and then there is also there is also problems in hearing, or ringing in the bell-like sounds are heard. There is also loss of memory, loss of smell, and then weakness of the arms and legs, and then also development of the seizures is seen. Okay, so next we will talk about the diagnostic. Diagnosis, we shall discuss the causes of meningiomas. Although the exact cause of the meningiomas is not yet clear for how exactly meningiomas occur, although because it is more common in the woman, so that it has been seen that the female hormones may be responsible, okay, for the development of the meningiomas. Also congenital neurotic disorder like neurofibromatosis 2. Okay, congenital disorders or inherited neurocognitive disorders, neurofibromatosis, and also obesity has been associated with the development of the meningiomas. Okay, so exact cause is unclear. Female hormones have been linked with the development because it is more prominent in the females. Also, it has been seen that whenever a client is present with a inherited neurocognitive disorder, say for example neurofibromatosis 2, and the existence of the presence of the meningiomas has been strongly associated together, as has been strongly seen together. These two conditions occur together. Okay, so also obesity has been seen, one of the other causes which may be responsible for the cause of the meningiomas. Other than that, there is also a genetic link which has been described. So the gene which is responsible for in case of the meningiomas is this has been seen elaborated production of NF2 gene in case of the neurofibromatosis, and also increased myelin protein production. Okay, increased myelin protein production and elaborated production of the NF2 gene has been associated with the development of the neurofibromatosis. So these were some of the causes for the development of the meningiomas. After the causes, we will see what are the diagnostic features in case of the in case of the meningiomas. Diagnosis, we have CT and MRI are used to detect the presence of the meningiomas. If we talk about morphology now, the mass of the cells which is which is called a meningioma, is usually well circumcised, spherical, solid, and as I said earlier, varying in size from 1 to 10 centimeters, and firmly attached to dura. Okay, so it will be firmly attached to the dura mater. Okay, so we have morphological features. It is well circumcised, then it is spherical, or sometimes also hemispherical. Hemispherical mass or spherical mass, and is solid mass, also varying in size from 1 to 10 centimeter, and then it is firmly attached to the dura mater. Okay, so these were some of the morphological features. This end is the meningiomas, and then we also have other topic, which is metastatic tumors. So in case of the metastatic tumors, usually we'll discuss it briefly. The tumors which may metastasize to the brain, they are usually present in the kidney, some of them. So metastatic tumors of brain. So usually the tumors which will be metastasizing to the central nervous system should primarily have the characteristic features as that of the tumor which is present in the brain. Okay, so what I mean is कि अगर किसी और सिस्टम में से कैंसर सेंट्रल नर्वस सिस्टम को जाना है, तो उस कैंसर का ये जरूरी, उन सेल्स का ये जरूरी है कि they are similar to the cells which are present inside, they are similar to the tumor cells which are present inside the brain. Okay, if a tumor was present inside the brain, say the shape of the cell was like this. So for any tumor to metastasize towards the brain, the primary characteristic feature should be same as that. तो ये दो सेल्स सेम होने चाहिए, तभी वो मेटास्टाइज होगा एक ऑर्गन से ब्रेन तक. तो अभी कौन कौन से ऐसे ऑर्गन्स है जहां पे सिमिलर कैंसर्स होते हैं और मेटास्टाइज होते हैं ब्रेन की तरह? लंग कार्सिनोमास होते हैं. ओके, ब्रेस्ट ट्यूमर्स होते हैं, ब्रेस्ट कार्सिनोमास होते हैं, स्किन कार्सिनोमास होते हैं. देन ऑल्सो वी हैव किडनी, and we have in GI tract. Okay, so metastatic tumors, rest all whatever is remaining in central nervous system, you guys please message me that whatever is remaining, and that will be an assignment for you guys then. So with this we have finished our central nervous system. Okay, hope if there is any question or any topic which is remaining, please let me know. Thank you.